Smallpox was a devastating disease caused by the variola virus, known for its high contagion and mortality rates. It spread primarily through close contact with infected individuals, via respiratory droplets, sores, or contaminated items, and could even survive outside the body for some time. Tracing back its origins, smallpox is believed to have first emerged thousands of years ago, likely among agricultural communities in Africa or Asia. As human civilizations expanded and established trade routes, the disease found new territories and populations lacking immunity, making them particularly vulnerable. This absence of immunity in new populations, combined with the severe and often deadly symptoms of the disease, facilitated repeated and large-scale epidemics. Prior to the development of the smallpox vaccine by Edward Jenner in 1796, and its subsequent eradication in 1980 through a global vaccination effort, methods to control its spread were limited. This contributed significantly to the historical prevalence and impact of smallpox, underlining the interaction between biological aggressiveness and societal factors in shaping the course of epidemics. Smallpox was a severe infectious disease known for its high mortality rate and devastating impact on populations worldwide, before its eradication. Historically, it was responsible for an estimated 300,500 million deaths in the 20th century alone. Those who survived often faced severe lifelong scars, blindness, or other disabilities. The disease was particularly lethal in communities with no previous exposure, such as those in the Americas during European colonization, leading to the dramatic decline of indigenous populations. The first major stride towards preventing smallpox was the practice of variolation, an early technique where material from smallpox sores was introduced into the skin of non-infected individuals. This method was risky but often resulted in milder infection and conferred immunity against the disease. A safer and more effective method was developed by Edward Jenner in 1796, who used material from cowpox lesions to create the first vaccine. This discovery was pivotal, as it provided a reliable means of prevention that was less dangerous than variolation. The global eradication of smallpox, declared by the World Health Organization in 1980, was achieved through an intensive vaccination campaign. This campaign was a massive coordinated effort that included widespread vaccination, vigilant surveillance, and quick containment measures including quarantine and immediate vaccination of anyone exposed to confirmed cases. The eradication of smallpox not only saved millions of lives but also became a historic achievement demonstrating the effectiveness of collective international public health initiatives. It remains the only human disease to have been completely eradicated through vaccination, serving as a model for current and future disease eradication programs. Smallpox has been eradicated worldwide, a remarkable public health victory declared by the World Health Organization in 1980. This achievement marked the end of a disease known for its devastating impact, as smallpox no longer circulates among the human population. The last natural case was reported in Somalia in 1977, highlighting the effectiveness of the global vaccination campaign that led to its eradication. Today, the variola virus, the causative agent of smallpox, is stored under strict security in only 2 locations worldwide: the Centers for Disease Control and Prevention, CDC, in Atlanta, Georgia, USA, and the State Research Center of Virology and Biotechnology, Vector, in Novosibirsk, Russia. These samples are kept for research purposes and to develop defensive strategies in the event of a bioterrorism attack. Since smallpox has been eradicated, routine vaccination for the general public is no longer necessary. However, vaccine stocks are maintained as a precaution against potential bioterrorist use of the virus. In such a scenario, immediate vaccination would be essential to control and prevent the spread of the disease. The smallpox vaccine is known to be highly effective, capable of preventing the disease or significantly reducing its severity if administered shortly after exposure. The global eradication of smallpox not only saved countless lives but also serves as a powerful example of what can be achieved through coordinated international public health efforts. Surveillance and rapid response capabilities are maintained internationally to ensure that any potential re-emergence of the disease can be swiftly addressed, keeping the legacy of smallpox eradication intact and preventing any future outbreaks.